Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Good morning. We're back here at Beehive Pediatrics, and we're completing our mini-series on autism today. And today we don't have a specific topic. We're just going to cover some of the questions we gathered from you all, from the audience. And we hope that you find them as interesting as we did. So we're just going to dive right in. So the first question I got, Heather, was a question about a study published in 2019, which is what I think it referenced. But the question was, is there any link between Tylenol use in pregnancy and the development of autism? It was a tough question, so I went back to try to look more deeply at this question. And I believe this came out of a study published in JAMA Psychiatry in 2019 that looked at cord blood acetaminophen, which is the generic name for Tylenol, levels, and the development of autism spectrum disorder as well as ADHD. So I want to break apart the study a little bit. So they had about 900 to 1,000 mothers who they had cord blood Tylenol levels for that met the threshold for the study. So what is cord blood acetaminophen levels? I think that's the first question. Mm-hmm. Cord blood is the blood they take right from your umbilical cord, exactly what it sounds like, right after you deliver your baby. And usually we use that for blood typing, but for this, they used it to look at what, if any, Tylenol did the cord blood contain. That's the first thing. That's what they looked at. And then they followed these mother-child pairs, which in research terms we call them dyads, so the mother-child pairs, for 10 years, which is a really long time, or until they moved out or weren't part of the study anymore. And the reason they did it for so long was to try to capture everybody who might be diagnosed with ADHD and or autism. So they looked at basically 1,000 of those mothers. Mm-hmm. All 1,000 of those mothers had Tylenol metabolites in their cord blood. So all of them had received Tylenol at some point during their labor. And then they tried to go back and control for things. So they tried to control for things that we think might influence autism, like, smoking in pregnancy. They tried to control for any confounding factors like very low birth weight. But one thing that they did not control for, which I think is important to mention, is they didn't look about if the family had any other children with a diagnosis of autism or neurodevelopmental disorders, which I think is an important predictor and an important aspect that they did not control for in this data set. And basically they found that there was an association between cord Tylenol metabolites and the risk for developing autism and or ADHD. A few things that I think were important about this study and my interpretation of the study was, one, they didn't control for important confounding variables. Two, I think the biggest problem I really have with this study is when you think about studies as a parent or a doctor, really anybody, what you're trying to ask yourself are these results generalizable to the population I'm going to advise this for? Mm-hmm. And so we want our results to be as generalizable as possible, meaning we want a really big number of patients so that we don't have the risk of, for example, let's say we're looking at the risk for something like sickle cell disease. Mm-hmm. If we have only 30 patients and all 30 of those patients are African American, that's going to skew our results because African Americans have a higher risk of sickle cell disease. Mm-hmm. So you want a really big sample size to try to eliminate some of that background noise of variables, if that makes sense. Mm-hmm. So they did have a big sample size, but one of the things that was not generalizable is at the end of the day, at the end of their study, only 30% of the children that in their study were neurodevelopmentally normal, right? So if you think about your community or the community your child's from, mm-hmm. or really, the United States at large, more than 30% of the children in the United States are neurodevelopmentally normal. So I would say that these results were not generalizable to the population at large because their sample study, their population was not obviously the same mm-hmm. as the United States population at large. Mm-hmm. So that was one big problem I think I have when you're looking at a study looking for autism and ADHD, and you already are having a sample of children who a lot of them wind up having this diagnosis, it means that maybe the risk factor was potentially something else. The second problem I had with this study, kind of on a theoretical level, is all of the things that we know about autism suggest that this process really starts in utero with brain development, brain pathway development. And Tylenol has a half-life, meaning it's in your bloodstream in a therapeutic amount for only 6 hours, right? 4 to 6 hours. That's why we give Tylenol every 4 to 6 hours. And so it's hard for me to conceptualize why a blood sample taken right at delivery of a drug that only lasts in your bloodstream for potentially 4 to 6 hours could affect the neurodevelopment of something that should have started much earlier. So I think this study has a lot of flaws. I guess that's my kind of takeaway point from this. I think the study had a lot of flaws. I think my recommendation to mothers would be, like any medicine during pregnancy or any medicine in general, you should only take it if you really need it. You should take the least amount that is therapeutically necessary. But I don't think this study was enough for me to change practice, and I don't think it was enough for big institutions like ACOG and OBGYNs in general to not recommend Tylenol to mothers.
One of the questions that we got was, is there a risk with epidural anesthesia and development of ASD?
So this is another great question. And as a mother myself and as a mother yourself, I'm sure you're like, man, we cannot catch a break. No Tylenol, no epidural anesthesia, nothing. So this was looked at, and there was an article published in JAMA Pediatrics in 2020. And I think it came from the fact that there was a previous study that showed mothers who have C-sections have an increased rate of autism in their children. But I think that was kind of explained by the fact that mothers who are having C-sections have indications usually for C-sections, and so that's not the baseline population like we were talking about earlier is not the same as vaginal deliveries or all deliveries in general. Usually C-sections are done for high-risk situations, and so that kind of baseline group of children is a little bit different. So this study in 2020 in JAMA Pediatrics basically looked at a large number of moms, I think something like 150,000 moms who got spinal and epidurals versus who did not. And they found a slight increased risk of ASD, so something like 1.7 versus 1.3, the difference between those two. And my kind of interpretation of the study was they were not able to control, again, for a lot of confounding variables. So they were not able to control for history, family history of ASD, family history of psychiatric disorders, children in the family or siblings, first-degree relatives with the diagnosis of neuropsychiatric, neurodevelopmental, or ASD. And I think when you take into consideration all the confounding variables that they were not able to control for, that might account for the small difference between the two. So I think it was a great question. It is a great question, and I think it probably warrants more research than what we have right now, because I think there were some weaknesses in the study that make it hard to fully say whether there really truly is a increased risk with spinal or epidurals and not getting epidurals.
Another great question that we received was, is there any benefit to prenatal vitamins in the same setting of ASD?
So I really like this question also because I think we talked a lot about potential things that might increase your risk for ASD, but is there anything that you can do as a mom to maybe decrease your risk for ASD? And there was a really nice study. It was published in 2017 in out of Sweden, and the great thing for studies in Sweden is they have really well kept federal records of diagnoses. So everybody who has the diagnosis of autism goes onto a federal registry. And so that allows them to do very in-depth analysis and also control or try to control for a lot of the variables we were talking about, because it's all registry-based data. So they looked at, I think, something like 300,000 infant mother dyads, and they looked back, so it was a retrospective study. Were they taking prenatal vitamins? So were they taking multivitamin or not? And there was a lot of variability within that multivitamin group. So some mothers were taking multivitamins with folate and iron, some just a multivitamin without folate and iron, some just folate and iron without the multivitamin, and some nothing at all. And I think the question arose from the fact that we know that there's a really well indicated use for folate in prenatal vitamins, which is preventing neural tube defects. So this population in Sweden of moms, about a third of them were taking prenatal vitamins, and a third were not taking anything, and a third were taking some combination that we talked about there within. And so they looked at the multivitamin category and the not. And they found that the mothers who were taking multivitamins had a 30% reduction in autism, having a child with the diagnosis of ASD with intellectual disability. So that's a really big reduction, first of all. Second of all, this study was, unlike the previous two studies, they were able to go back and control for all of those things we're talking about. Was there any risk of, were there any other, medications or drugs that they were taking antenatally that might have affected these results? Was there any family diagnosis of psychiatric disease? Was there any family diagnosis of ASD or other neurodevelopmental defects? So they were able to control for a lot of these variables and weed out a lot of this noise before they got down to this 300,000. So they actually started with a much bigger number and got down by kind of weeding out that noise we were talking about earlier. So I think this was a powerful study. I think it's great. We certainly want moms to take prenatal vitamins to prevent neural tube defects anyway. And maybe there's the added bonus of also having some reduction in the risk of ASD, which I think is really interesting on a pathophysiological level. Like, why might that be? But I think it's a great thing that we can recommend to our mamas and say, besides neural tube defects, hey, there might be this added benefit. And then interestingly, this study was mirrored in a second study that was out of Israel that showed the same thing. Mothers who take prenatal vitamins had a decreased risk of having a child later on diagnosed with autism spectrum disorder. Nice. So I think that's one more reason to kind of take your prenatal vitamin, choose it, a little bit beforehand, but it can be hard to take every day, for sure, especially in the beginning when you're already not maybe feeling great and a little nauseous, but now they come in like gummy forms, flavored forms, unflavored forms. So I would say, reach out to your other mamas if you're looking for one that isn't disgusting or you don't like the one you have, but definitely take it.
So one of the other questions we received from the community was, how can you support a friend with a child recently diagnosed with ASD?
So this is a great question. There's no evidence behind it, like the first three we talked about. So there's not going to be any studies, at least that I know of how to do this, but I think it's important. I personally would think, some ways to be inclusive of children with ASD is kind of how I think of supporting your family or community or anybody who has a child with a diagnosis of ASD is how can you kind of include them? First of all, I think it can be a little bit hard and disheartening. I imagine, like, as a mom, you want your kid to go out and make friends and play and go do all those things. And sometimes children with ASD are not really interested in playing with other children. They kind of sometimes want to do their own thing. So I think, first of all, as a friend, being okay with that and not, remarking on it, or I think sometimes like you're trying to be inclusive, you make a bigger deal out of it. So I'd say maybe like, not make a big deal out of it. Know that can be normal for children with ASD. Children with ASD tend to really love activities that are stimulating. So like, I really love water tables. So trying to have something that they might be interested in playing with, like a water table or a sprinkler, or I think trying to create an environment that is allowing, and inviting for all children. And I think that extends to the community at large. I think when communities and public school systems are thinking about how they plan and create their shared play space, making that accessible for all children. So sometimes, like, one that comes to mind for me is gated playgrounds for sure. Sometimes children with autism will run away. They can be a little bit of like what we think of as a flight risk. So making that space safe for them by making sure it's contained and safe. Having swings for bigger kids that have that, those swings that pull down so that kids can get into them easier and stay safe in them. Having some of those sensory swings we posted on our Instagram is also a great one.
Those are great.
Yeah, those are I think, so some children with autism love the vestibular, which is your ear sensory input. And so that's why they really find swings like calming, or they find that particular type of sensory input stimulating. So having swings on the playground, if you're part of a community board that's planning a playground, is a great idea. And then I think the other thing is just being there and being a good listener, trying not to do a lot of talking, but just a lot of listening. I think there's an incredible amount of guilt for many parents when their child gets diagnosed with any neurodevelopmental disorder. And I think that's where a lot of these questions come from. Like, did I do something? Did I take Tylenol? Did I consent to an epidural anesthesia? Did I do something that did this to my child? I think listening to them and hearing them out, and then encouraging them to go out and, try to participate in like self-care. So, maybe saying like, I'm hearing you, like, this was not your fault, making sure that they have time. I think like say, hey, drop off, your kid, go take a 30-minute run, go outside, get your hair done, have a hot coffee, all the things I say to my newborn moms that are musts. I would also say try to do that for your parents who recently received this diagnosis. So my newborn mommy you must make time for a 5-minute hot coffee. You can't have a coffee and leave it for an hour and drink it when it's cold. You must make 5 minutes for yourself to put on your clothes and put on a little bit of makeup and make yourself feel like a person again. And you must have a little bit of time every day for yourself to take a shower alone. With nobody else in it. So kind of encouraging them to participate, I think, in their own self-care and prioritizing that. And another really nice way to do that is journaling. And I think the best way to do it is kind of lead by example. I do a 5-minute journal every day. I have like a mindful journal. It's like, what are the 3 things that you're grateful for? What are a couple things that you wish you could work on? I think it's something that, it has to be something where, for me at least, that it doesn't take very long, but it's mindful practice based. And I think journaling is a nice way to do that. And I think the more people do it and the more people talk about it, the more inclusive it becomes.
Good recommendation.
So those are kind of some of my thoughts. I'm sure there are more out there. I would love to hear other people's thoughts on this topic. I think it is a great way to kind of crowdsource all of our brains and come up with ways that we can support parents and children who are going through this. So we hope that you found this mini-series on ASD to be helpful. We hope it's a great resource for the community and for parents and loved ones and anyone out there looking to support anybody with ASD. Again, if you guys have any questions or comments, please leave them below for us. They are often really interesting and ignite good conversations with others. So I hope you enjoyed this series.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.